Hi everyone, I'm Dr. Ratnakar, consultant in care hospitals. Nowadays we are seeing hip pain irrespective of age. Previously we used to see hip pain in the older generation, otherwise in the younger people because of other diseases like rheumatoid arthritis or ankylosing spondylitis, where the hip joint rotations are become fixed, they can't able to move freely, and a lower back is also an issue for them. Nowadays after the COVID, this is like before COVID era. After COVID, there are a lot of hip problems are coming. If people are presenting as a low back pain or a thigh pain or a groin pain. For any hip pain, it can travel to any direction. That is why people will come with a knee pain also sometimes, or a back pain also. If you carefully detect, there will be a movement restriction in the hip joint for them. So it is mandatory people who are presenting it will regularly examine their hip joints also if they complain knee pain or in the back pain also, because in between this is commonly missed. Hip pain is increased after the COVID. Whether they got a COVID, got admitted, or the steroid therapy or a COVID virus itself or some vaccine is very difficult. There is a lot of studies are going on. But within a short span, people are suffering. Their walking style will change within months, within 2 to 3 months. I never had any, people will complain, I never had any problem, I am having small pain here. It started, but my walking has changed drastically. So they will limp. If you carefully examine, they can't cross leg one-on-one. This is called avascular necrosis, AVN hip. AVN is also there before COVID. Usually in young people, generally 20 to 30 is the common presentation for them. It's because of AVN or idiopathic condition, what we say, there is no reason for that. It can, some genetic element is also there. But after COVID, we are seeing a lot common of these problems. It's in the young population more, 30 to 40 and 40 to 50 also, either male or female. So both is increased. There is no reason, particular virus itself can be a reason, because a lot of people said that we never suffered, we never detected COVID, even then they have a hip problem. So it goes mostly with suspicion. Some people will tolerate the pain, some people can't tolerate it. If it is detected early, usually the early stages can be detected in the MRI only. In the late stages, you can see in the X-ray also. So MRI shows some changes, grade 1, grade 2 changes. So we'll advise to decompress the solution. What will happen in the AVN means the ball and socket joint, it's a hip joint. We'll say it's a ball, this is a socket. The blood supply to the tip of the cartilage should be smooth, will become dead. That is called avascular necrosis, means the blood supply will become meager for this area and slowly this part becomes dead. Mostly it comes in the weight bearing surface, means the weight transformation for the body in the top part. So slowly the movements also get restricted. Initially complaint is the pain. So this is smooth, the ball will rotate. So as soon as it becomes rough, irregular, the cartilage layer will go and the pain starts, and slowly the area will increase. The ball becomes irregular. If initial stages it was detected, generally we will try to delay the process by giving calcium supplements, painkiller occasionally, do regular exercises so that the muscles won't compromise. Otherwise the muscles will become stiffer and stiffer because of the pain and lack of movement. And second thing is, what we do is we'll try to put a hole in the joint so that the pressure will come down, the blood supply improve, and it can halt the process from going from stage 2 to stage 3 to next level. How long? It's very difficult. It is not a foolproof surgery. It is not a must surgery. Some people will get benefited, some people may not get benefited. The result with the surgery is variable from person to person and grade to grade also. If you delay, you can have the better movements. That is the only thing, you have your native hip. At some stage, if it is gone grossly, stage 3 or stage 4, the movements will get limited. The only option they have to do is replacement. Replacement means we need to replace the ball. We need to remove the damaged ball. We need to put a stem like this into the thigh bone and a cup placement here. This is what we say total hip replacement. And this is the end stage for some people. Even if you take a core decompression tablets, but people will ultimately has to end up into grade 3 or grade 4. So end choice will be the hip replacement. It depends of how much time it will take to travel from stage 1 to stage 4. It varies from person to person. Treatment is for their symptoms like pain and movements only. It is not decided by the X-ray or MRI. How much suffering you have. Once it is diagnosed, it depends upon how much suffering you had, how much limitations you have in doing your activities. That is the only mandatory whether to go for a core decompression or a hip replacement. Hip replacement, next day you can walk, there is no limitation. Slowly you can improve the distance, you can climb the stairs, you can drive, you can do a fast walking. Only thing is, we'll explain to them is not to sit on the floor or squat for lifetime, because there is a chance of dislocation, the ball coming out. This is the only instruction we'll give for any hip replacement for any age. This is the only restriction. But you can do your activities regularly, whatever in the lifetime, that is normal for them. Most of the people will think the medicines will cure. Some people will go to homeopathy, Ayurvedic also. We have seen a lot of people. So because it's not like an emergency, people will wait and they will suffer. It is the lifestyle. Because if they limp and walk, the result, the effect will be on the back also. They will have back pain starts and the disc problems also starts. Their life also goes. People will think I can delay. How long you can delay? It's very difficult to answer for any doctor to say that. Because research doesn't say how fast it will travel to the next stage, how far you can wait. So if you have a symptoms, you need to get treated, depends upon your severity. It is not a staging that some people will have huge pain in stage 3, some people will tolerate pain at stage 4 also. So it is independent. Surgery is the only option to make you better in the AVN. Medicines, as such, there is no medicine for an AVN. You can delay the process by interim procedure like core decompression with stem cells, but you can halt the disease process. But how long, on which patient is more beneficial is also a difficult answer for any doctor to say that. As such, painkiller is not a long-term goal, because for any pain, painkiller is the only solution. And more important, the people who are suffering with AVN or delaying the process, they need to understand the life is more important. You need to, pain-free life is more important. If you delay it also, you are delaying your pain. So that's more important.